right. Beautiful. So we are live right now. So first of all, welcome everybody. People are just going to show up as we go throughout this presentation. And as a service, we always record these presentations. So we will make sure that they're available for you to watch them later on. We'd like you to, you can send us a message. Throughout this presentation, basically, we want to share with you certain things that are really important to how we see the treatment of heart disease that is being approached today, and what are the gaps in care, and what can be done. And you're welcome always to share comments, or if you have any questions, just use the comment box to do that under the video, and we'll address them together. So today, to start, this service, this presentation comes to you from the Heart Guardian system. We are an advocates for healthy lifestyle changes regarding heart health in specific. Today, we have a wonderful guest, and I will start with some introductions so you know who's here. I'll start introducing myself. My name is Erez Avramov. I'm the co-founder of the Heart Guardian system. I have my co-founder with me here, Carol Thorney, and together we really looked at the issue of the gap, basically, of what a patient needs and what the system has to offer, and what is that gap and how it's being treated today, and what we recommend. But the reality for us was this. For myself, I come from a background that health has been quite a challenge throughout my journey. Went through almost 3 near-death experiences in less than a decade. And the last one was really the biggest and most difficult one, was a heart attack. This is what introduced me to the world of heart disease. This is what introduced me to the gaps of care. And this was the brainchild of the entire Heart Guardian system. So today we will share with you a little bit about what we do and how we do it. But I want you to meet Carol Thorney. And please, Carol, take the stage.
Thank you, Erez. I'm Carol Thorney, and I have an extensive background, over 20 years in healthcare, both from the payer and the provider, and I've also worked with life science companies as well, really focused on doing a lot of work around transforming healthcare, including medical economics, ensured social determination of health, closing disparities, both in not only population, but also across different disease states. And I'm a big advocate, and I've worked with a lot of really great people in the space and learned a lot from a lot of the healthcare professionals, especially medical directors and chief medical officers, who are really leading the way in changing how we look at health. And with that, I will hand over to Dr. Allen, and you can tell us a little bit about yourself as well.
Hi, my name is Christopher Allen. I'm a cardiologist and an interventional cardiologist and structural cardiologist at West Virginia University Heart and Vascular Institute. I'm also chief of cardiology at WVU Medicine Wheeling Hospital. I've spent more than 28 years in cardiovascular care, both here in Pittsburgh and at the University of Pittsburgh Medical Center, and now at the West Virginia University. Very interested in preventative heart disease. As you know, I'm an interventional person who therefore takes care of the disease when it presents itself. But I think what's very important is to try and address this from a preventative standpoint, so that you do not have this occurring when you present to me with acute myocardial infarction also. If we can get to that stage, I think we'll be able to therefore help people a lot. And that has been part of my drive, to try and help people, prevent them from getting to the stage to ending up on the heart catheterization table and the balloon angioplasty and stent.
And this is something we see again and again, which is unfortunate, and it can be managed better, is the fact that once a patient goes through a cardiovascular event, they get some intensive care right after the event, but then there's a pretty much a gap of care between that end of acute stage to the next one, which usually it's after the condition deteriorates, and then they have to go back to the hospital. And that gap could be managed so well with the right guidance and with the right lifestyle changes, that this is, really our mission to, first of all, share with you today what we see, and also share with you some ideas of how that can be managed better. And this big gap that is still out there, to have the ability to control that a little bit better. So with that said, Dr. Allen, can you give us your high level view of what's going on out there today? You're muted, sorry. You're muted, Dr. Allen? That's okay.
Let me talk about the state of disease in our country. What's most important is that as far as heart disease remains the leading cause of morbidity and mortality throughout the country. And even if you think about things like cancer, and a lot of people are more concerned with cancer, the most common cancer, there's about 5 to 10 times greater proportion of people who present with heart disease. And that's why it's very important that we address this at the basic level of trying to prevent these patients from presenting to us in hospital. And what's also important is that, as shown in this slide, at least 1 out of 5 patients who are hospitalized with a heart attack are readmitted to hospital within 30 days, and 1 out of 4 patients with heart failure are readmitted to the hospital within 30 days. A lot of this is not just recurrent symptoms. I think some of it is based on the ability to understand their disease process and communicate with someone who can help them increase their understanding. And I think therein lies the real basis of improvement, is that if we can increase their ability to understand the process and then what needs to be done to help them be better and live healthier, that would be very important for them both in the short and long term.
And Dr. Allen, what do you think causes this gap in understanding the state of disease and how patients can actually manage it better themselves?
Well, if you can go to that slide on adherence, Erez, we can talk about that a little bit. What happens is that, we should think about this as a compliance issue, the patient's not being compliant with what we say to them when they leave the hospital. But I think there are many levels which interact to allow patients not to be able to follow those instructions, because as they go home, they're now faced with this life-threatening disease that they first understood when they walked into the hospital. And how can we now impact them? Because these patients, well, one, they are scared. Therefore, they don't hear everything that you say. For two, there are a lot of determinants of health that really interact with them. A lot of patients are actually depressed and isolated. And therefore, their interactions with you when they go home, they see their own mortality and therefore are very hesitant to do anything, because before this event, they were well enjoying their life. So if we can connect with them and then show them gradually, establish that relationship with them, we will be able to actually turn this around, because then you experience somebody who is actually sympathetic to the position that you're in and able to help you walk it through in a staged manner, therefore you'll have better outcomes.
This is such a powerful point, Dr. Ellen, and I've just added a little tip here on the screen. You mentioned something, and I remember this from my own experience after my heart attack. First of all, you're pulled into that world not willingly. It's not something you invite into your life. And when you're in that state of fear and anxiousness and you don't really know what's going on, even though the healthcare professionals that are taking care of you have the best intentions and they probably said all the right things, it's not necessarily that as the patient at that particular situation, you listen and you hear and you actually absorb that knowledge. So I think you struck a very, very powerful point here where even if you hear once something your doctor tells you or a health professional shares with you, you don't necessarily compute and understand it because of the condition you're in. So a little advice, and I have done this throughout my career in health and recovery, it was to ask permission to record the meetings. A lot of times it's to have someone with you there that can be another pair of eyes and another pair of ears to understand what it is and really see how things can be done a little bit differently there. Yes, Carol.
No, I was just going to say, we might want to step back a little bit. And we talked about, 1 in 4 and 1 in 5 patients having challenges with readmissions. But if we go back to the beginning, where let's really talk about how big the universe of cardiovascular disease is. So if you go to the next slide, Erez, you can walk us through this, because it's really much larger than a number of 1 in 5. What does this really mean in terms of events?
Yes, and I think a lot of us hear in the news, different causes of death and the numbers, and we all are being exposed now to COVID-19 and the implications of it. But what's underlying all these conditions is something that we understand and see every single day. These numbers that you see on the screen right now are representative of the US alone. We're not talking about the entire planet here. We're talking just about the US alone. So we're talking about almost 660,000 deaths from heart disease every single year. We're talking about 605,000 new heart attacks every single year. And the most frightening part of this is that we see out of those 600,000, 200,000 are recurrent heart attacks. And a lot of them should not happen. It's that gap in sometimes care, gap in knowledge, gap in treatment, gap in how the patient themselves interact with their condition to make sure that this doesn't happen again. And of course, the burden on the system is huge. We're talking about 900,000 cardiac surgeries a year. Dr. Ellen, who is so gracious to give us his time here, is always around an operating table here or there to deal with these things. And here are the statistics. Every 36 seconds, we lose a precious soul to cardiovascular disease. And this is in the US alone. These are the numbers. Now, Carol, maybe you can touch on the cost, personal and cost to the system as well, what we're looking at.
Absolutely. And I would add to that, Erez, that women are now leading the way in cardiovascular disease. So, the problem used to be just men. Now we're competing in all kinds of ways, including heart disease. And, what that means from an economic perspective, and it impacts both the healthcare system and it impacts the cost of healthcare. So, when we talk about why is my healthcare so costly, this is just one disease state, right? This is just one disease that's costing over $216 billion a year. And when we talk about lost productivity, when someone's ill, it impacts their work. They're on workman compensation in some cases, or they lose their income. So just lost productivity for employed individuals, and the burden to the employers is $147 billion a year. So they're astronomical numbers. So, we're talking well over $163 billion in direct and indirect costs, and there are all other costs that's rolled up in there. But the major pieces is the cost of the healthcare, and therefore that impacts the individual, and of course, loss in productivity. So that's pretty significant. If we look really quickly at the map, and where we're seeing 90% or more, like 95% across the U.S., that cardiac disease is the number one killer in every state. And where it says cancer, it's the second leading cause of death. So it's not third or fourth, it's the second. So it's pretty high in every single state. And that is certainly something to make you sit up and take note.
And to put it in perspective, because in our audience we have health professionals that actually know the cost of what they need to manage, but we also have a lot of people in the audience that are cardiovascular patients today. They either had a cardiovascular event, God forbid, and thank God you're with us and watching today, or you're at high risk, right? High cholesterol, high blood pressure, all the pre-symptoms of cardiovascular disease are there. And I want to connect this to the day-to-day life of a patient. We all have to pay for our health one way or another. And the cost is always very, very high. And Dr. Allen, maybe you can touch on the point of what you see when a patient didn't manage their health condition in a way that they could have maybe reduced the treatments that came after versus those who are more proactive. Maybe you can touch on that.
Well, what we've seen is that we, as a part of the American College of Cardiology, have decided that we should do something to impact these patients on a more personal level. And we actually had a program called the Patient Navigator Program, which started in about 2013. And what it meant to do is to see if we can improve these outcomes in these patient cohorts over interval periods of time. How can we impact them? How can we help them understand more about their disease process and therefore make healthy choices? And that's what's most important. If we can get them to make healthy choices, we can now get into the realm of secondary prevention to prevent them from ever getting back to that primary event. So that whole Navigator program was quite successful in establishing ways in contact with these patients, and the relationship that has been established between the navigator and the patient, it also means something about trust and the ability to have someone be able to, they're not isolated anymore. You can actually have someone to talk to, how we're feeling, what's happening to them on a day-to-day basis. That establishes that relationship, and then establishes a trust to now make those choices and help them get to the next level.
Very powerful. Carol, maybe you can touch on the kind of the traditional rehab process and what we see out there today, because this connects directly to what Dr. Allen just shared, where are the touch points? How are we taking care of these gaps?
Sure. If you could step back one, that would be great. One of the things that we want to certainly touch on as well is, we just went through, or still going through a pandemic with COVID. And one of the things that came out of that experience for both patients and providers is the ability to now extend the way that we can impact each other in a positive way by leveraging technology. There's more comfort and acceptance around remote monitoring. And so as we look at some of the traditional ways of providing care, we can now leverage some of these new technologies and new ways of communicating with each other to close some of those gaps. Next slide, please. So if you look at, traditional cardiac rehab, and feel free to jump in, Dr. Allen, you have an episode, there's a treatment, in the hospital, or a minute clinic if you're lucky to be right there, or in facility, and you end up in the OR, the ER, to the OR, and you spend quite a bit of time in the hospital. Your post-discharge, and here's where we start to see some variations, is it's being managed by professionals, and there are lots of tests that you go through. But one of the things that we see pretty common is that there's a post-discharge of a 30-day window. After you have a surgery, you have a stent put in, there are a myriad of procedures that Dr. Allen can speak to. And then that rehab ends. And so when we talk about gaps in care, we're not speaking negatively about patients and their journey or the healthcare system. They're just some natural gaps that happen based on your premiums, the type of health plan that you sign up for, and also just the rhythm of the transition of care. There's been a lot of attention on transition of care, not necessarily real care coordination, right? And so, Dr. Allen, this is one of your big points, recidivism, and how does that happen? And, so we go from being in a cocoon in a hospital where, they're giving you your meals, they're having you sleep, giving you your medication, and your meals are prepared by a dietitian. Then there's some continuation of that after rehab or during the rehab period. And then, what typically happens is, the patient goes right back to doing what they were doing before. So there's a decline in outcomes. And the brain forgets pain as quickly as we can. So when we start getting back into the rhythm of our regular lifestyle, we forget some of the teachings that we've gotten through the experience as well, if it's not reinforced. And then, of course, from a healthcare and health system perspective, we go back into a cycle. So there's increased direct and indirect cost again. So if you go to the next slide.
Patient goes back into their own milieu, in their own environment, and all of the things that were there before are now facing them again. So it's very hard for them to make that change. And that sort of leads to the recidivism that we see, is that they go back to the same usual habits, the same usual friends, without any sort of an interaction to help them change that pathway. And therefore they end right back up in the hospital again with another process.
And Dr. Allen, when you see patients that come back, after that window, and they kind of regressed back to their, old patterns, what's usually the advice you give them? How can they try and address it better?
Well, here, the advice that you give is the advice that you try to prevent them from doing things. And, as Carol said, is that, listen, when you are actually going through this event, that is the most impactful time where they can make change. And I'm sure the majority do understand that they need to make change, but going back into that environment without the support, without the guidance, without the contact, it's very easy to slip back down the slope into that same milieu.
Yes, and this is the main challenge that we've seen. As I said, this was the brainchild of the entire Heart Guardian system. It's really, how do we provide an environment that can support the people that have to go through these changes, because change is difficult. We're not wired to just flip the switch and change our habits. And for many, the initial change that we see happens within that usually 30 to 60 days after a traumatic event. And it's done because of fear. It's not done because you really want to. It's not done because you are committed to that change. It's all of a sudden you had a heart attack. Oh my God, I have to stop smoking, or I have to stop and eating, fried food, or I need to walk more. Or so you start to interact with the condition in more of a fearful approach versus a lifestyle change approach. And this is where what we're trying to share with you today is to really open up the conversation, to be really honest and admit that change is difficult. We know what needs to be done. We know the techniques, we know the parameters. We can give you the list of the best foods you need to eat and how many minutes a day you need to exercise and all of those things. Those things are tested and proven by science and for decades. The problem for us at the end of the day, the receiving end, and I count myself as one, as patients, is how do we implement that? How do we actually follow through where difficulty will be part of the journey? And this is where guidance comes in. This is where Dr. Ellen has just shared. And the next slide, I think, Dr. Ellen, you can dive a little bit deeper into it. By providing just a person who can be around you, speak with you, and kind of just check in, what are the big differences that we see, if you can address that.
And before we move on, I also want to address the fact that sometimes you just inherit those wonderful qualities from our ancestors, right? So you may have been a jogger. I mean, how many people have cardiac events while they're actually exercising, right? And so there are some issues there too, where you may be living a good lifestyle, but you may not have been aware that you had a predisposition, or were paying attention to some of the markers that would tell you early that you have a condition that you need to manage better as well. Dr. Allen, over to you. You're on mute.
Oh, Dr. Allen, I think you're on mute.
There you go.
Yes. So when we looked at it, we saw there was an impactful change in these patients' lifestyles when they were involved in that personal interaction with the navigator. And you can see the significant change as far as their education went up, their 14-day follow-up went up, and their readmissions went down a lot. So that's about a 68.6% improvement in their readmission rates, due to the fact that they're now understanding what they need to do. And with that interaction, they now can make healthier choices.
So Dr. Allen, can we break that down a little bit, right? So for the average person out there, when we talk about a navigator program, they have a heart event, they're in the hospital, they're going through discharge services, there are a whole bunch of paperwork that you have to fill out and instructions, and there's some follow-up appointments that you have to make, and so on and so forth. What is a navigation program, and how is that set up? How do I know I've been connected with a navigation program?
The Navigator program is a program where you have a contact with the patient about 2 or 3 times per week. And you speak with them about what they're going through, especially in patients who have heart failure. You speak to them about their diet. You speak to them about what their blood pressure and their weight has been. And therefore, you can interact and say, listen, you're gaining weight. You've gained more than 5 pounds weight over past week. This is just water retention. So that now, if you can start the process of intervening before they get to the point where they need to be in the hospital, then you can decrease that from happening.
So I'm, again, I like to boil things down a little bit here. So I just had a cardiac event, and I should be paying attention then to water retention. I have new medications that I'm taking, and what is my what do I have the ability to do after post-cardiac surgery versus I just had a stent put in? What's different between the expectations? Because I think that's part of what sometimes people end up back in the ER or calling 911 because the minute they have any kind of chest pain, they automatically think they're having a heart attack. So what are like some of the symptoms that people normally experience, and when would they reach out to a physician, or how important would be the navigator to help to stabilize or inform them so that they know what to expect?
Well, it's part of the education process. You can educate them to know exactly what to look for. Yes, I agree with you that after an event, you're more likely to be conscious of things that you would have ignored before. But if you understand how the presentation is, what you look for in the presentation, then you're more comfortable to say, okay, that's not what I'm happening. I will just stay home.
Yes, and this is where really the power of, first of all, knowledge is power at the end of the day, and a lot of us are just overwhelmed when a new condition is introduced to our lives. There's a lot of catch up to do in terms of the condition itself and the symptoms and what's going on. But the other part that a lot of people ignore, which is really the mental drain that is involved here with the condition itself, with listening to all these doctors and all these experts, and everybody tells you should do this and you should do that, and your friend comes in with a book and he says, hey, you know, cholesterol is really not the big problem, but it's this, and you need to eat more cabbage and not as much this and that. And that confusion creates a state of basically when we work with our clients, a lot of them, they just come to us in a stage where they just froze. They can't make a decision. They're so confused. Information comes in from all directions. They don't know what's true, what's not. They should do this, they should do that. Maybe the changes that they are required to do are just overwhelming. And what you do is you hide your head under the sand and you just hope maybe it'll just pass and it'll go away. And unfortunately, heart disease, you know, it's an invitation to a very prestigious club that the getting out of it is very, very difficult. It is possible, but it is difficult. So this is where things need to be addressed in a different way. And
so if we could just a minute, so the navigation program. So this was a study that was done at Montefiore Hospital. This was a series of case studies that were done nationally. And so these statistics are really the result of a navigation program where they looked at members who had cardiac events and had a coach that reached out to them post-surgery, post-discharge. That was part of their rehab plan. And this person stayed with them for a 30-day period, Dr. Allen, and did the education, did follow-ups on a weekly basis. And that's the result of that was a reduction in readmission rates and a better conformance to medication adherence and basically their care plan. And so, care plans, we do have care managers in healthcare companies. And so between the primary care physicians, the specialists, and the care managers, it's not like they're not trying to help, but even with that, there's still a gap, right? Because it goes beyond the 30 days. So what's next, and what are some of the adherence issues that you're seeing? Dr. Allen?
When you look at adherence, it has many facets to it. And I think the first thing is to try and understand why patients are having adherence problem issues. Okay? If you can understand why they're having adherence issues, then you can actually help them. So if you go to the next slide, we talk about the different ways you can understand the reasons for non-adherence. We talked about poor health literacy, which the patients do not quite understand what they're going through, right? If they don't understand, then they can't make those healthy choices and healthy change, okay? And like I said earlier, having gone through a life-changing event, there are social isolation and also episodes of depression and perceived episodes of lack of effect. If you have no one to interact with you to say that, you've gone through this event, it's not the end of the world, here's how we're going to do to prevent you from ever getting back here. That actually helps them get over these understanding what needs to be done and then make the healthy choices.
yeah.
So does that mean I can't have a donut after the event?
Yeah, I mean, the big part is really how alone you feel after these events.
Mm-hmm.
Nobody can really understand you.
Correct.
A lot of people, especially men, feel that they need to be these, strong macho men for their families and for their, social networks. And at the end, you're left empty inside. Fear is part of the process. Confusion is part of the process. And when you have someone that actually understands what you're going through, someone who can actually support you on that path, the chances of you not just recovering better, but actually adhere and do the changes from a real place, not just out of fear. I mean, we've seen the change in a drastic way. This is why the whole idea of just giving you knowledge is really not enough, because it's difficult to just, it's like you read the greatest book in the world and it can change your life, and then you close it and it stays on the shelf. It's the same thing here. We give you, and the system gives you a lot of information which is life-saving, but to actually implement that, to follow through that, and not to allow all sorts of situations to take over, because I can tell you that depression and isolation are two huge challenges everybody has to work with. And if you try to do it on your own, chances are very low to succeed on that level. So Dr. Allen, can you touch also on the tools and the support and the other items that you have here?
You're mute.
You're muted.
As you look at the opportunities that you have to try and address these things, I think it actually sort of seamlessly runs similar to what the heart guidance system is doing. You have to have behavioral support and motivational interviewing, meaning help to motivate them to do better, help them along the pathway well. Okay. Then not only that, you also have to monitor their adherence. So you know what their blood pressure is, what their weight is, and therefore things that help you to achieve this monitoring also supplements the interaction. And having done that, if you now see the patient not doing well, your communication will be, you know what, and you need to call your doctor because this is not going the way we need it to be. And what we find is that people react better when they are in the home-based environment where you can interact with them, where they're more comfortable, where they're not more stressed, and therefore they have better effects.
Yeah, and these are really important points, and the reason why we share this with you guys here on these webinar series is really to understand that there is a variety of impacts and a variety of challenges that we are faced with. It's not just one thing or the other, it's a combination of a variety of them. And how do we bridge the gap? How do we really create the ideal environment so you can stay on track, so you can actually implement what is needed? Because I can tell you from a patient perspective, the shift in how you address your health is where you really take responsibility for your health, and you stop blaming others or the system or life or something else that has happened to you, and you start to understand that there are certain fundamentals that need to be in place. And unfortunately, a lot of heart disease is caused by improper lifestyle choices. So now we have to really rewind those habits and implement new ones. And this is where coaching is helpful. This is where guidance is helpful. Accountability is helpful. And this is what is really needed. Now,
That leads right into some of the interventions, right?
mhm.
Dr. Allen, you touched on some of these, but it's always good to re-emphasize some of those key points.
Yeah, we talked about, education about your medication. You understand what these tablets are and what they're for, and help them understand what self-monitoring and how important that is for them to understand, to monitor themselves so they understand what their objectives are. I like to say you have to know your numbers. You got to know your numbers, what your cholesterol should be, what your blood pressure should be. And therefore, when you monitor, you have a better understanding of that interaction. And the importance of adherence tracking using mobile health resources is also huge in trying to prevent you from ever getting back to that stage.
So let's talk about medication a little bit, right? Because I have father passed away recently, but we all have elderly parents and relatives, and they always think that they can, maybe I will take it today, right? Or maybe I'll only take one. And so what are some of the challenges and some of the techniques that you've used with your patients about adhering with their medication?
Well, having them understand what the medicine is for and how the medicine works. If you're supposed to take it twice a day, it's because the medicine has no effect after 12 hours. So that is, those are the basic interactions that they have to understand specifically what each of these medications are for. And it's not just because we want to order medicines, but you have to explain to them what this is for and how it works.
And so there's a lot of talk, in social media, the drug companies are just trying to get your money and the doctors are just trying to, create costs. And so, again, part of the education is having them understand that these medications are specific for their conditions, right?
Correct.
And the efficacy of it.
And Dr. Ellen, what do you say to people that actually come to you with that approach? Medication is just the pharmaceutical companies are trying to make more money on my account, and the doctors are doing this and that. How do you address this?
I try to explain what the necessity and what the data has shown, and try to tell them exactly how best to live their best life if they can make these changes.
Yeah. And I want for the viewers that are with us here and watch the recording after, you need to understand that doctors have, on the most part, always have the best interest at heart. Sometimes when you don't understand why things are done, or your doctor doesn't have the time or the patience to explain to you why it's needed, a certain procedure, a certain habit change, a certain medication, we tend to go to Professor Google and try to diagnose ourselves and say, oh, this is good and this is bad. The reality is that there's a process here where every person has to really grow into this knowledge base and understand more and more. And this is why the educational part that Dr. Ellen just shared, it is crucial. And education sometimes, as we know, if you just rely on, I don't know, social media for your medical symptoms, or you just Google it, very problematic. Especially when there's a little word like a study or a research attached to it, as if it's now gospel and it's true. It's very difficult to discern reliable sources of information, reliable studies. There's an entire process that we will cover during this series of how to read studies, how to search for research that is really peer-reviewed and has the responsibility of the presentation is part of the whole process. So just to share with you today, this was an introduction to the subject. It's something we can talk about for years. But today we just really wanted to focus on understanding that there is a gap in care, and we're not judging it. It's just the way it is. But there are ways to bridge that gap. And when we talk about coaching, when we talk about support, when we talk about monitoring, those are the things that, at least for us with the Heart Guardian system, we found to be extremely efficient. And when they are combined together, when you have guidance on your nutrition, which is tailored for what you need, when there's guidance about your exercise and what type of exercise you should do, and your stress management and your sleep management are all taken care together, it's like a program on steroids. You cannot fail, because there's someone there to hold you accountable. There's someone there to really have your best at heart, right? I mean, when you talk to a coach, this person is there because they want you to do the best you can. And there's the efficacy of motivation, there's the efficacy of accountability. And this is really what we're talking about here. Carol, maybe you can touch on the processes that are available today versus programs like ours and the difference.
You want to go to the next slide?
Sure.
So, just kind of recapping and kind of recentering us a little bit, right? So when we talk about, the standard cardiovascular interventions that we have today, we're not going to spend a lot of time on cost, but you can see there's a clear process, right? And all of what we've been talking about, the medication management, getting you to adhere to your care plan, and also to really understand your disease. What does this mean? How is it going to change my life, or how has it changed my life? And part of that change is recognizing your responsibility as well, shared responsibility along each of those parts of the journey. So, when you have an event, or you don't feel well, pick up the phone, call 911. Right? There are emergency facilities that are in your town that can help you. The ER departments, they're much more efficient than they ever have been. And, the intervention is the key. So, what we want to prevent here, and what we're really talking about, is not only having each member understand their disease better, but understanding how we're all impacting the system, right? The more everything costs, the more it impacts the cost of hospitals, seeing your doctor, and your healthcare cost. But the key is we want to make sure that you're not on a gerbil wheel, going in and out of the hospital, because every time you go into a hospital, it increases your chances of a worse outcome. Your indirect and indirect cost, both from a healthcare perspective as well as the individual cost, as we mentioned before. But what's really nice about where we are right now is there are lots of intervention facilities, mobile devices. I have everybody has a watch on that tells them what their heartbeat is, or how many hours they slept, how many steps they've done for the day. And if you don't, you should get one. And part of that is being interactive with your own care, understanding it better. And then how do you move from just being an outsider looking in on your healthcare, but becoming a real participant in your care coordination, and therefore changing your lifestyle. If we go to the next slide. So how do we make that change? If you remember, one of the first slides we looked at was, you go to rehab, and then, there's more of a chance of recidivism. What we're saying here is, with lifestyle management and coaching, so it's leveraging devices that can check your blood pressure. It can check your digital weight, your weight machine that will send a digital signal to your doctor about what your weight is. We can check your sleep and stress monitor, your sleeping patterns, your stress levels, and you also will have an ability to also interact more with your care providers. So, we're going from episodes to treatments to referrals, and what we know is that once you get engaged, and if you get engaged early as part of your discharge planning, cardiac rehab coupled with remote monitoring and a lifestyle management through coaching really changes the tide. So now we have an opportunity to have a real engagement with someone that's going to be your coach throughout that journey. There's an easy enrollment process. We do assessments, health risk assessments. We also create, customized nutrition plans. We have devices. Everybody, has access to, a phone, a tablet, etc. And so being able to put tools in your hands that will help you to manage your healthcare better, and be able to interact with, ask questions, and attend group sessions as well, which we find are quite helpful in helping you stay on track. So monitoring comes in multiple forms and multiple ways, so that we try to not have a one-size-fit-all scenario, because everybody's a little different and some things work better for other individuals than others. So having some flexibility even within a program structure. But the key here is measuring success, your individual success, the success of the program, being able to make adjustments, because we'll be able to see real time how you are doing, and you'll be able to see that as well as your cardiologist and other people that are in your care team.
Mm-hmm.
The most important thing at the end is that you're also now seeing better outcomes. The health plan is seeing better health outcomes, and that reduces the cost for everybody across the board. Erez, I didn't know if you wanted to add something to that.
Yes. So first of all, the reason that we're here is because this is something that we've put together, and the power of combining, personalized nutrition and exercise and stress management and sleep management with coaching and accountability. That was a lifesaver for me. And this is what was created afterwards to serve others. And today we really want to invite you, and you'll see here the link on the screen. We'll also share it in the comments when we repost this. But we really invite you to learn more, right? And understand what options are available for you today. Whether you're a person who went through a cardiac event or you're at high risk and you want to understand how to manage your condition better, we invite you for a conversation with us, where we can really share with you what's available, what are the options, and see where you're at. Or if you're a health provider and you're looking to manage your patients in a better way, you're looking for this adherence and reduce costs, all of those things can be done here. So you're more than welcome to just book a call with us through that form that you see the link on the page right now, and really learn more about what options you have. And if you have any questions to Dr. Ellen, to Carol, or to myself, you can always reach out and share this. Dr. Ellen, anything?
I'm just happy to be part of this information update, I should say, and what are the necessary options for taking care of yourself and going forward. And this ability to interact and establish that understanding of your process and what's happening to you, and ways that you can get better, and ways that you can help yourself get better, and ways that you can monitor yourself. And as I said before, ways that you can know exactly what your numbers are, and know how that impacts you in the short and long term. And I think it would be very good as far as going down the road to a road to recovery, a road to better health, and a road to successful outcomes.
Beautiful.
If I might add to that, I think we also want to remind everybody that we will be doing this as a series. And so if anybody would like to, send us a note as well, and let us know if there are any specific topics they would like us to consider to cover. But we tend to do this as a series. I think education is so important in really understanding your condition. There's a lot that gets thrown at you when you're not well, or if you're a caretaker for someone who isn't well. There's a lot that needs to be done, and it's a shared burden, right? And so the key is, keep doing what you're doing, but keep getting better at doing what you're doing. And there's a lot of support out there, and you just need to know how to tap into it.
Yes, and that's really the key here. There is support for you, and by tapping into that really allows us to move from where we are, to the outcomes we're looking for. And what is it? We want to have a healthy life, a happy life, life free of disease. We don't want to carry this, dark cloud around our heads all the time. If, a little pain in the chest, oh my God, is this a heart attack? Or, you don't go away on vacations, or you even leave your house because you're afraid that something may happen. All these things could be managed and well cared for. So you're invited to book a call with us, fill in the form, and really send us also any questions you may have for our next webinar, which will take place next week, same place, same time. So I want to thank Dr. Ellen. Dr. Ellen is a special breed of doctors who really care. I mean, the reason why he's here, the reason why he's sharing his message is because there are doctors who are really good at their work, and there are doctors that are just there on a mission to really help and change health outcomes. And we're privileged to have Dr. Allen with us. Carol has years of history in the health industry, and she knows exactly what's possible. Sometimes we think it's too complicated, but it's not. And we're just here to really share with you the message and open that to a conversation. So with that said, thank you all for being with us. We'll see you next week, and have a beautiful rest of your day.
Here's to good outcomes. Thank you.
All right. All the best.